is Allison Maskell, and I am one of the physical therapists in the main campus physical therapy department. In the main campus physical therapy clinic, we have 5 physical therapists and 1 support staff. On Centennial campus, we have 1 physical therapist. For those of you who are not familiar, this is the front entrance to Student Health. We are on the corner of Cates Avenue and Dan Allen. You also can see the beautiful rotunda by the front doors and the appointment desk. The physical therapy department is located near the back entrance from the parking lot. If you have questions about our department, you can go to our webpage. You can learn about what PT is, how it can help you, specialty areas offered, eligibility, therapist profiles, and more. But today I wanted to talk to you about low back pain. This is one of the most common problems that we see in our clinic, and we wanted to help you learn more about what it is and how to help yourself. Back pain can be classified as acute, or up to 4 weeks, subacute, from 4 to 12 weeks, and chronic, which is more than 12 weeks. Low back pain will affect most people, up to 80%, at some point in their life. Low back pain is the leading cause of activity and work limitations throughout the world and is associated with a significant economic burden. About 1 in 4 Americans report low back pain lasting at least 1 day or 24 hours in the last 3 months. And we do not know a definitive cause of low back pain. The good news is that most people with acute or subacute low back pain will improve over time regardless of treatment. So what can you do to prevent future episodes of low back pain? First, we have to consider the modifiable and non-modifiable risk factors. Areas where we can make a positive change to the risk factors would be your weight. Try to lose weight if you're overweight or obese. Increased body weight can put increased stress on the low back and, in fact, all the joints in the body. Stop smoking. Consider your activity level. If you're too sedentary, increase your activity level. Sitting has been said to be the new smoking. Prolonged sitting has been linked to cancer, type 2 diabetes, heart disease, and depression. Look at your posture, both in sitting and standing. We're going to talk a little bit more about this later on. Understanding of low back pain. Many people feel like they are given a sentence, a lifelong sentence, when they first have back pain. But back pain can be managed and people can live normal, active lifestyles. Pain does not equal dysfunction. Core strength. We want to improve that core strength, and this will help support your low back. Flexibility. Decreased flexibility can put strain on the low back, as many of the muscles that attach to the pelvis, that same bony structure that many of the low back muscles attach to, causing a bit of tug of war. Things we cannot change are age, sex, body type, genetics, the aging process, or degenerative changes. Other risk factors can include a history of low back pain, fear of moving, our bodies were meant for movement, low expectations of recovery, depression, stress, education level, occupation, for example, repetitive activities or heavy lifting, and a passive coping style, or just ignoring the pain.
Hi, my name is Donna. I'm one of the physical therapists here at NC State. So you may be asking yourself, where does back pain come from? Well, we know that any innervated structure in the lumbar spine can cause symptoms of low back or referred pain into the legs. Potential structures could be muscles or ligaments, even intervertebral discs, thoracolumbar fascia, and vertebral column. We're going to go into these in a little more depth. As you can see in this graphic, the vertebral column is made up of 3 major curves. the lordotic or concave neck or cervical curve, the kyphotic or convex mid-back or thoracic curve, and the lordotic or concave lower back or lumbar curve. Below these three curves, the spine ends with the convex sacrum and coccyx. These curves normally balance one another out. On the right side of the slide, you can see that the spinal cord begins at the base of the brain and tapers off beginning at L12 segments of the lumbar spine, though the nerve segments do continue down into the coccyx. The ligaments and intervertebral disc are highlighted on this slide. On the left, the strong ligaments are white and span from one bone to another or down multiple levels of segments to produce a tethering type of support for the skeletal spine. If torn, these ligaments can produce pain. The intervertebral joint or disc is shown on the right in a side view, seen in this illustration as blue structures sandwiched between the bony spinal segments. In the cross-sectional inset, we are looking at the annulus fibrosus or concentric rings of fibrous cartilage that encircle the more gel-filled nucleus pulposus. Only the annulus is sensitive to painful pressure and tears. If enough pressure disrupts this hydraulic disc system, then the nucleus may seep out, producing the proverbial ruptured or herniated disc. An incident such as this can cause not only disc pain and back pain, but pressure and pain on the sensitive nerve roots that are exiting just posterior to the disc, potentially causing referred pain or numbness and tingling down one or both of the legs. Here you can see those spinal roots exiting the spinal cord near the discs. It is apparent how close these structures are to one another, and so are susceptible to any structural or inflammatory changes in any of the soft tissues or bony spinal segments. We have mentioned the core muscles several times so far, and here they are. On the left, you can see the upper six-pack muscles of the rectus abdominis. When you perform a sit-up or lift your head, these muscles will engage. But the core muscles that we want to focus on are the ones underneath those sit-up muscles that include the internal abdominal oblique, the external abdominal oblique, and the transverse abdominis that are further dissected in this graphic on the side of the vertically running rectus muscle. These core muscles not only connect anteriorly to the ribs and pubic bone, but also wrap around laterally to intertwine with the fascial layers that you can see on the left side of the slide in the lumbar spine, which is represented in white, helping to produce a corseting effect when contracted. This lends great support and stabilization to the lower back and abdominal areas. We have learned in the past 30 or 40 years that the appropriate segment or appropriate engagement of these core muscles are critical to the safety and well-being of your lower back. Now, why didn't the doctor do any imaging? A lot of people ask that, and don't I need an MRI because my back is hurting or my leg is hurting? Well, the current recommendations from the American College of Physicians are that primarily imaging is only indicated for severe progressive neurological deficits or red flags. A neurological deficit might be a loss of strength in your foot, so you might have foot drop, or you may have trouble with bowel or bladder control that came on pretty suddenly. And so these are all emergent types of situations that need to be addressed by a doctor. But we know that routine imaging generally does not result in clinical benefit and may lead to harm. So in the past several years, there's more and more research that says that a conservative approach in the beginning is more important. And so MRIs are often not ordered in the beginning. So other things to consider about MRIs are the cost. It can be very costly, over $1,000 easily, and sometimes it's covered by your insurance partially, sometimes not at all. So that's one thing to consider. Also, there are many false positives that can occur. There have been studies beginning in year 1990 that showed that asymptomatic persons can actually have severe structural changes in their back, but not have any symptoms. An example might be a herniated disc or a narrowing of your spine or some osteoarthritic changes in your joints. They have done studies in asymptomatic people that show that they may have a lot of these things, but or don't have any problems or don't have any pain because of them. So because of that, we don't want to overuse MRIs that may lead the doctor or the therapist down a path of thinking, oh, well, I can't fix this. I need to send them to the doctor, or the doctor saying you need to have surgery. We always start with a conservative treatment, physical therapy, chiropractic, other less invasive ways of dealing with pain. And then if that's not working, then moving to the next step. So what can I do about my back pain then if I'm not going to get an MRI? Well, for one, you can get up and start moving a little bit more. We all know we all sit too much these days. As Allison mentioned before, sitting is the new smoking. So we know that sitting is not good for our bodies in the long run. Our bodies are not made for sitting for long periods. So getting up and moving, like getting out of your chair from the computer and doing that, was helpful. We also know that exercise is regularly used to prevent recurrence of back pain. That seems to be, of all the studies we've seen, that's one of the main things that seems to help reduce or prevent back pain is exercise. Is finding that right balance that is the key. We'll talk about that in a minute. Stretching is another big thing. If you noticed on the slides before, you have your long leg muscles. These leg muscles attached to your pelvis in some cases. If those muscles are tight, they're going to change the relationship of your pelvis to your lumbar spine and perhaps cause some low back strain or pain. So stretching those muscles is important. We're going to go over evaluating desk and lifting ergonomics because obviously, again, most of us are sitting or standing at desks for long periods of time. Some of us have to be doing some lifting in the labs and whatnot, and then following some backpack guidelines so that we know what works best. Most of the students on campus are carrying backpacks, and some of them are quite heavy and they may be contributing to their problem. So we know that computer ergonomics is key and is important. Most of us know that we want to be setting our computer monitor up so that we're looking straight ahead at it or slightly down from the horizontal position so that it does not strain our neck. At the same time, when you're sitting or standing and you bend your elbows, you want your keyboard to be right there where you can reach it comfortably. And your feet should be on the floor and supported. So again, this could be sitting or standing. Those rules for the monitor and the keyboard are the same. If you have a laptop, you also may want to consider detaching the laptop, getting a detachable keyboard so that the laptop can be sitting on a pile of books or a stand that'll be at eye level, and then your keyboard will be down where your arms are, your hands are, so that's comfortable as well. What about proper lifting mechanics? Many of you may not have to do a lot of lifting, but I know that some of the guys in engineering have to in some of the labs. So you want to make sure that you're bending at your hips and your knees. You can see that that's critical. We know that the back muscles are not made for heavy lifting, so we want to use those big, strong leg muscles to do the work. So we're talking about proper lifting body mechanics. You want to think about several things. First of all, you want to move the object that you want to lift closer to you or step closer to it. You're going to have your feet wide and you're going to bend at your hips and your knees, not your back. Your core should be tight. Then as you lift it up, you're going to bring it in close to you and then stand up using your powerful leg muscles. As we indicated before, you don't want to lift with your back because they're not really made for lifting too much. It's really the strong leg muscles that do it. And then to put it back down, you're going to do just the opposite of that. You're going to tighten the core, bend at the hips and knees, lower down and back up. When you have lifted, if you want to move it to the left or right, you want to move your feet rather than twisting your trunk. And that way you protect your back. And then when you put that back down, you're going to do just the opposite of what you just did. Tighten the core, bend at the hips and knees, and down you go, and all's well. All right, so as far as backpack guidelines, because everyone is carrying a backpack around here at NC State, you want to make sure you're doing it correctly. We see a lot of folks who come in and say their backpack's too heavy, or when they carry it across campus, it causes back pain. So first of all, Allison is holding a backpack that maybe would fit her. We want something that's going to fit you, not too big. So first of all, Allison, if you will go ahead and put that on, you're going to slide it on so it's going to be held on both shoulders, hopefully padded straps so it's a little better for you. And then as far as adjusting it, you can see it's too low right now. She's going to pull the straps as far down as she can or until it comes all the way up to her upper back. That way it's not pulling her backwards too much. Also, if your backpack has a hip strap, you're going to put that one on as well because that's going to take some of the pressure off your back. It's going to distribute the load onto your hips instead of onto your back. And that can be very helpful. You want to pack light. So we know that most people will carry their laptops, which is fine. Just pack that first, closest to your body, and then the lighter stuff will be further away. And then when you have to bend, same thing, bending at the hips and knees. If you have to pick something up, as you would normally have to do, then that will protect your back. Then you can organize, as I said, to put the lighter stuff towards the back and try to clean your backpack out maybe once a week so you don't have too many things in there. But in general, we want you to have not more than 10 to 20% of your total body weight in your backpack. So if, for example, you weigh 100 pounds, you wouldn't want to have more than 10 to 20 pounds in the pack, including the pack, because that could be too heavy for you and cause some back strain. So now we're going to talk about some exercises you can do, but I wanted to give you some guidelines before you get started. Whenever you're doing exercises, you want to do ones that at least make you feel better or don't make you feel any worse. So although we're showing you several exercises, they're not going to be appropriate for everyone. In general, you want to make sure that you're not causing any pain to shoot down your leg, pain or numbness and tingling, and you don't want any sharp pain to occur with the exercises. A little bit of low-grade pain, especially in your back, is okay. So the first exercise I'm going to show you is called trunk extension. So I'm also going to turn sideways. She put her hands on her hips, and she's going to bend backwards, shifting her hips forward and leaning backwards, just as far as is comfortable. You don't have to go as far as you want to, but just enough that you're gaining some extension or closing those facet joints we talked about earlier. Also, it helps recenter the disc, takes a little pressure off your back. And you can do that whenever you've been sitting for a while. You get up and do a few of these exercises. It can be very helpful. All right, the second exercise is hamstring stretch. And again, because the hamstrings can be tight and tilt your pelvis backwards, pulling on your back, we want to make sure these are flexible. So what she's going to do is bend forward, but she's going to bend at the hip, keeping her back straight. So you can still use your core to protect your back while you're leaning forward. You'll feel the stretch with the back of your leg, and all of the stretches you'll be holding for 30 seconds. And I usually ask people to do it a couple times on each side. All right, the third exercise is a quadricep stretch. We talked about this. The hip flexor and quadricep can pull the pelvis forward and put strain on your back. So I recommend that you tighten your core and make sure you keep your hip and your knee in line with one another. And that looks really good. A lot of times I'll have people hold on to something just so they don't have to worry about balancing. And 30 seconds for each leg for this one as well. All right? And the last one in standing are called mini squats. You're going to put your hands on your hips, or if you want to, you can put your hands up at your shoulders if you're going to do some weightlifting, or you can put your hands out in front of you as well. The key notes are that you're going to bend at the hips and the knees, your core is going to be engaged, and you're going to sit back as if you're sitting into a chair so that your knees don't translate over your feet too far, because that can cause knee problems for you. And you can see that the stronger your legs are, the less you're going to have to use your back. So we want those to be as strong as possible. You want to use good form, particularly if you're adding weight in the gym. Great. Now we're going to do some floor exercises. So now you can do some exercises on the floor. If you have a firm bed, that's fine as well. Same guidelines apply. No increased pain that's sharp, nothing down the legs. The first one is going to be knees to chest. You can do one or both legs at a time. I'm going to hold for 5 seconds and do 5 times on each side or together. This is going to do 2 different things. One will open up those facet joints we talked about earlier, and then also will help stretch out your lumbar spine and your gluteals. Good. The next exercise is a lower trunk rotation. You'll have your feet together and your knees together. For this one, I want you to keep your feet on the surface you're exercising on, then roll slowly to one side until you feel a gentle stretch on your back and your side. You're going to hold that for 3 to 5 seconds and then pull back up, and you'll go the opposite direction. And you can use those good core muscles to help you control that as well. And you'll do about 5 times each way. Very good. Now we talked earlier about the transversus abdominis and the obliques, those core muscles. And these are the ones that you really want to be able to control well. So Allison's putting her hands on her pelvic bone so she can figure out what's happening there. And then she's going to pull her belly button in toward her spine, just flatten her belly a little bit. And that is when you'll feel like you're engaging those muscles. It'll just feel like a tightening under your fingers. Go ahead and relax. If you find that your abdominal muscles are lifting up toward the ceiling, you're probably using the sit-up muscles, which are not the ones you want to use. You want to use the ones where you're tightening and flattening the belly and holding for maybe 5 seconds, and you'll do about 5 of those. These are exercises you can do throughout the day, particularly when you're changing positions, just to get your back ready for movement. All right, once you learn how to do core tightening, you can add bridging to that. So you're going to tighten your core, then you're going to lift your hips up off the bed and hold that for about 5 seconds. You want to make sure you don't arch up too far to bring your back too far out of neutral, which can cause pain. You're just going to hold for 5 seconds. This will work on core strength, quad, hamstring, and glute strength. Great. After you do those, then you can go right into a hamstring stretch. This is another hamstring stretch that you can do on your back. You can either do it this way or loop a towel or a belt around your toe. And when you're doing it in this position, you can also move your ankle around if you want to, just to kind of give it a little extra stretch, not only for the hamstring, but for the nerve that runs down the back of your leg. And again, we talked about the leg pain before. If this causes pain or numbness and tingling, you want to modify this exercise. And you can always modify any of the exercises by not doing it as aggressively, doing less of them, not pulling as far, or actually stopping altogether if one exercise bothers you. Very good. All right, the last exercise is called a bird dog. So Allison's going to get on her hands and knees. She's going to tighten her core so that her back is kind of in a neutral position, or if you will, like a tabletop. So if she were to place a glass of water on her back, she'd be able to keep that glass of water from spilling as she's doing this exercise. So the core is tight. She's going to lift one arm and the opposite leg at the same time. Good. And then she's going to alternate. Now it's a little more difficult on this table because it is a little cushier. On the floor it'll be a little easier to do. But in general, you want to try to limit how much you rotate from side to side, which shows me that the core is really being engaged and being used appropriately. All right. Thank you, Allison. So you've done all these exercises. You've looked at this video. What if your back pain doesn't go away or it's actually getting worse? Well, at that point, we recommend that you go see a provider, either here at Student Health or outside with any provider that you may be seeing for medical reasons. Once they've evaluated you, they can determine whether you're a good candidate to come for physical therapy, and they can give you a referral. You will need to have a referral before you can see a physical therapist here at NC State. We'd be more than happy to see you, and we'd love to see you and help you get better so you can get back to your regular activities. That's all we have for today about the back class. I hope you've enjoyed it, and we hope to see you soon. If you need to come in, we'd be glad to follow you up. Thank you.